Hello everyone. So I'm Dr. Tawseef Raza. I'm a practicing rheumatologist from past 7 years now in Uday Omni Hospital. Rheumatology is a specialty branch of medicine. It's a still evolving branch in India. It's evolved and practices in multiple countries and developed countries especially. In India, we are still, it's a budding branch of medicine where we treat the rheumatic diseases, which includes the autoimmune diseases and autoinflammatory diseases. Autoimmune diseases like where the immune system of our own body goes overreacts the situation, attacks the soft tissues like muscles, the bones, the joints, the ligaments, tendons, including the fat tissue and skin. And the most common autoinflammatory diseases are also included in this branch of medicine, like gout and Mediterranean fever, scarlet fever, like that. Conditions are also included. And the most common rheumatic diseases that we see is the rheumatoid arthritis, which affects the majority of population apart from the osteoarthritis. In rheumatoid arthritis, especially the small joints of the hands, the toes, the ankle, shoulders, and the knees are most commonly affected. Unlike the osteoarthritis, they have the swelling, early morning stiffness, these kind of features they have. And it's a very prolonged chronic illness. And it's a systemic involvement is seen in majority of patients, including cardiovascular problems, lung problems, liver problems, and the kidney is always at the risk because of the medication that we prescribe. So there will be a regular monitoring of the diseases and the organ function. People doesn't know who is a rheumatologist, what exactly rheumatic diseases are, and the specialty is very specialist doctor in India, very rare, and especially they are there in the developed cities. In the rural area, hardly there is a rheumatologist available. And for a layman, any joint pain associated with the swelling more than 6 weeks is a sign of rheumatoid arthritis. And any rashes over the body, like the typical malar rash on the face that we see in the lupus kind of patients, SLE we call it as, and the hardening of the skin, difficulty in moving the fingers, especially in the early morning hours, suggests of some scleroderma, chronic cough more than 2 months, 3 months, dry cough without any constitutional symptoms of tuberculosis like that. So these kind of features suggest that you should consult a specialist in rheumatology. I am a member of EULAR School of Rheumatology, so I basically follow the EULAR guidelines for the treatment of rheumatoid diseases. And it's a very prolonged treatment. The patient generally asks, how long should I take the medication? So the simple answer is the prolonged treatment. They have to follow the treatment on a regular basis. Regular interval on regular interval they should take the renal function test and the liver function test to monitor the side effects. And in the early years, patient used to get the crippled fingers and with permanent deformities. Now we are able to prevent those deformities with the new established guidelines and the newer drugs coming day by day into the market after the prolonged clinical trials, randomized control trials. Now we have biologic therapy apart from what we give. Usually we give the conventional DMARDs, that is disease-modifying anti-rheumatoid drugs. Now the biologic treatment is available, slightly costly, but it's more effective given in combination with the conventional DMARDs. And as I said earlier as well, rheumatoid arthritis is not just affect the joints, it's a systemic disease. And 20% of cases develop the cardiovascular complications. And the 10 to 15% develop the lung problems called as interstitial lung disease. They can develop eye problems like in Sjogren's syndrome. They have a redness and blurred vision in the eye. and kidney complications can be developed. So overall it's a systemic disease. So we in Uday Omni, we have a complete setup here for the rheumatology follow-up cases and the complicated cases of rheumatoid cases, and we have special laboratory facilities too, because in most of the parts of the India we don't have the special tests that generally we use in rheumatology specialty. It's unlike the other specialty, it has special antibody testing, which cost of therapy goes very high. So we are trying to bring down the cost here with the special packages to the patients as well, and trying to treat at a very lesser cost compared to the other areas.